Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today, November 23rd, 2025, this video is on a JAMA review article on peripheral neuropathy published online on November 17, 2025. What is peripheral neuropathy? It's damage to the peripheral nerves causing motor, sensory, or autonomic symptoms. Why is it length dependent? Longer axons have higher metabolic demand and are more vulnerable to injury. What are the early symptoms? Toe numbness, tingling, and burning that progresses proximally. How common is diabetic neuropathy? Up to 50% of people with diabetes show neuropathy on testing. What tests are used to identify common causes? Fasting glucose, hemoglobin A1C, vitamin B12 with MMA, and serum protein electrophoresis. What medications cause neuropathy? Chemotherapies, amiodarone, metronidazole, and excess vitamin B6 among others. What are red flags? Rapid progression, severe weakness, asymmetry, autonomic crises, or systemic symptoms. Is EMG always needed? Not always, but it changes diagnosis in up to 43% of the patients. When is skin biopsy useful? When small fiber neuropathy is suspected and EMG is normal. What is the role of autonomic testing? Used in patients having prominent autonomic dysfunction. What helps painful diabetic neuropathy? Gabapentin, pregabalin, duloxetine, and tricyclic antidepressants. How effective is gabapentin? About 38% achieve greater than 50% pain reduction at 1200 milligrams per day. Does glycemic control reverse neuropathy? It helps prevent progression in type 1 diabetics, but less so in type 2. Can neuropathy from toxins improve? Sometimes, but often incomplete even after stopping exposure. What foot care is recommended? Daily inspection, protective footwear, and avoiding burns or injuries. What vitamin deficiencies cause neuropathy? Vitamin B12, B1 that's thiamine, vitamin B6 toxicity, and copper. How is B12 deficiency treated? 1 milligram IM weekly of vitamin B12 once a month, and then monthly or 1 to 2 milligrams daily orally. What is the treatment-induced neuropathy of diabetes? Painful acute neuropathy after rapid glucose correction. How common is monoclonal protein-related neuropathy? Seen in 10% of neuropathy patients. Can hereditary neuropathies be treated? Most lack targeted therapy except transthyretin amyloidosis. When is neuromodulation used? For refractory neuropathic pain unresponsive to medication. What medication should be avoided? Opioids are not recommended for neuropathic pain. How fast do axons regenerate? Approximately 1 to 3 millimeters per day when the cause is corrected. Why are sensory axons more affected? Fenestrated dorsal root ganglion capillaries increase vulnerability. What is the prognosis? Symptoms often persist even when the cause is treated. These are some eponyms related to peripheral neuropathy. Hit pause and read at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.